Prynawn da, mae'r digwyddiad yma ar fin dechrau. Good afternoon, this event is about to begin.
Croeso, diolch am dod y prynawn 'ma. I'm Claire Bevan, registered nurse and the senior responsible owner for the digitisation of the Nursing Documentation Project in Wales. And with me today are Fran Beadle, the Chief Nursing Information Officer for Digital Health and Care Wales, leading the Standardisation of Nursing Documentation, and Leslie Jones, the Head of Nursing, Hywel Dda University Health Board and National Lead for the implementation of the Welsh Nursing Care Record in Wales. Also, we have Kerry-Ann John, the Senior Business Change Facilitator for Digital Health and Care Wales. We'd like to welcome you to this Welsh Nursing Care Record stakeholder event, focusing on the nursing documentation standardisation and the implementation of the Welsh Nursing Care Record. The aim is to share the journey of the development of the digital Welsh Nursing Care Record for adult inpatients as part of the development towards the single patient record. We'd like to thank you for taking the time to join us today, and we value your thoughts and feedback to inform our next steps of the Welsh Nursing Care Record journey for our patients, staff, students and organisations and wider stakeholders. There will be an opportunity for Q&A. Please share your name so we can get back to you. There will be time for questions for Fran and Leslie and Kerry-Ann at the end of the presentation. The April edition of the NHS Wales Digital Nursing newsletter will include the frequently asked questions and feedback from our 4 stakeholder events we've hosted this month. We will now start the presentation. Thank you, Fran.
Thank you, Claire. First of all, I'd like to welcome you all and share to understand and share our journey to our standardisation and implementation of nursing documentation. Apologies, but my screen. Okay. So, why did we decide to do nursing documentation? So across Wales, when I first came to Digital Health and Care Wales, I went round to Wales to look at the standards of documentation, and it was identified that there was really a lack of standardisation across the health boards and trusts in Wales, in that there was no standardisation potentially from ward to ward and not across health board boundaries. So alongside that, there were audits that had cited that nursing with poor documentation, and they came from Health Inspectorate Wales, in addition to the Andrews report and the Flynn report, both identifying that either the lack of documentation or the fact that the documentation didn't actually tell you what had happened to the patient. And in addition to that, although there was no standardisation, there was a lot of duplication. You know, potentially patients came from the emergency department and the information from there wasn't shared with the ward nurses. So everybody was replicating what either the previous nurse was writing or the next person was writing. So obviously alongside that, there was poor user experience, but actually a lot of repetitive questioning for our patients. And when we looked out there was some instances up to 72 pages of nursing documentation, and I would say that part of that was a consequence of, you know, nursing have been very good at saying yes, we'll add stuff, new documentation items in due to poor standards, but actually what we weren't doing, it was looking at the root cause of the problem and the process. So the idea was that rather than manually auditing documents, we would standardise our documentation so that our patients who could move seamlessly throughout their journey in Wales. So the Welsh Nursing Care, the idea of the Welsh Nursing Care Record was born, and in the first instance it was for secondary care adult inpatients. However, the standardisation has developed and evolved to the standards for nursing documentation across all health care spectrums, whether that be community care, secondary care, tertiary care, emergency departments, critical care. So the idea is that the information is collected once and reused many times. So the vision for our Welsh Nursing Care Records was that nurses and midwives, plus the multidisciplinary team, are confident and competent with using the Welsh Nursing Care Record, and that they utilise that data that's inputted to improve patient outcomes, but to able to understand our organisational situation and share our learning across our health board boundaries, and ultimately provide seamless care to our patients and our staff, as a lot of our services move across health board boundaries with specialised services. So, and that builds off the vision from our previous Director at NHS General, Dr. Andrew Goodall, that our patients should be able to move across health board boundaries with standardised and digitised patient records. So how did we achieve this? So in the first instance, we needed to ensure that we had a robust governance structure within that. And so our robust structures incorporated our chief nurses, our chief nursing officer, from the chief nursing officer down to the nurse user on the floor, because it was all very well to have the hierarchy telling us these are the things that we needed to do, but we needed to ensure that the digital solution that we were developing was usable by those on the ground, because if it wasn't usable for those on the ground, it wasn't actually going to achieve what we wanted to, which was to simplify and fine-tune our documentation to support our patients and document once and reuse many times. So alongside that, as Claire Bevan, our SRO, who's just introduced, was the chair of our board, it had to be a nurse-driven development and design, and that governance supports that. So we made sure that we reported back to the various organisations across Wales, so that would be the directors of nursing and the chief nursing officer, but also with our directors of informatics colleagues, plus Welsh Government and our clinical informatics councils, to make sure that what we were developing everybody was aware of, but actually like we were utilising the same standards of documentation across. So for instance, within our multidisciplinary teams and going, and I'll explain further around the standardisation and how we got to achieve that. So we've split into 3 work streams. So there's a new document stream, our technical and data reporting work stream, and our implementation work stream. And all of us work very closely together with the national team and with our health boards leads. So as part of this, the development of the Welsh Nursing Care Record, I was the only clinical informatics specialist when I first arrived in Wales. But it was very important that the health boards owned this and were part of the development. So what we were enabled to do was to provide funding to support the introduction of new clinical nursing informatics specialists in every health board in Wales. And where we are currently is that we have chief nursing information officers within every health board, as well as clinical nurse specialists as well. And that's very important to support not only the standardisation, but the implementation and the technical team. Because alongside the nursing colleagues, we also have product specialists within every health board. And it's about joining the dots to ensure that we're all working towards the same goal and the same set of priorities to actually benefit our staff and our patients. So like I mentioned, we have the high level governance structure, but underpinning each of the work streams, there is also a governance structure. So with regards our standardised documents, the aim was that we went to our specialist groups. For instance, for pressure damage, we would go to our specialist TVN nurses to look at the current evidence and make a recommendation of that evidence to support what was going to be the best tool to use and what would be user friendly. And we did that with all our documents. So that's falls, manual handling, continence. All of them went back to national specialist groups that weren't just nursing, they were multidisciplinary teams as well, to come back with a recommendation. And based on that recommendation, that was then taken through each health board's governance processes to approve those documents. Once those documents were approved within the health boards, they were aligned to and shared with our Clinical Informatics Council, and also with allied health provider groups, allied health specialist groups, and then they were taken through that whole structure back up to the directors of nursing and the directors of therapies to approve and sign off those standards. And then finally, once all those standards were agreed with all those forums and professional groups, there was an issue of a Welsh Health Circular from the Chief Nursing Officer of Wales. So we have a complete trail from end user up to the Chief Nursing Officer to ensure what we were recommending and developing were approved across Wales. So what have we standardised? So in phase 1, the initial standardisation, we've standardised our adult inpatient assessment, falls risk, post damage, continence, patient handling, pain assessment and nutritional risk assessment. And like I mentioned before, we would go off to the specialist groups and we would ask them for a recommendation, and with the adult inpatient assessment that also included patient groups and our safeguarding teams and clinical risk, many people to understand the requirements. And also part of that was to test that actually works. So initially we did test on paper, and we also piloted in every health board across Wales in a digital version to ensure that whatever we developed was user friendly. And based on those pilots, unfortunately COVID happened right at the end of those pilots, so we did have to stop those early, but the information that we gathered from those pilots was invaluable, because what we were able to understand was it user, but to make the changes that were recommended by the staff to ensure that we improved what it was before we went into national rollout and implementation. And there is a list of the phase 2 documents that we're currently working on, and I can say to date we have standards on food charts, repositioning charts, Bristol stool charts, mouth care, end of life, frailty and wound care, and the work is ongoing. So we have a rollout implementation plan of what documents are coming next to implement across Wales. And now over to Carrie Ann.
Thanks, Fran. So as a team of business change facilitators, we were brought into the project in April of last year to support the nursing teams across Wales during their rollout. So this map is showing the hospitals that we've covered in the past 12 months. None of us realised last April that we would be helping the health boards to achieve this huge coverage. And up to today, the three of us have helped nearly 2,000 nursing staff in 22 hospitals, gaining their trust and supporting them through to get the best out of the WNCR in the first weeks and ongoing. But it was clear from our first day in Withybush Hospital in Haverfordwest with the Hywel Dda team that the programme team had delivered an application that went over and above nurses' expectations. Even those who have a fear of technology are soon clicking through an assessment, quickly realising the benefits that being able to read each other's handwriting and quickly finding the section they need to look at without shuffling through pages of paper. With each new rollout, within a day or two, it's common occurrence to have nurses approaching us when we walk on towards with questions on how they can best use the devices. The nervousness of carrying a device soon disappears when they realise that they can sit next to a patient's bed being guided through the form with the intuitive layout. From the tiny community hospitals caring for just 8 patients to acute sites with hundreds of patients, each site presents its own personalities and challenges. But yet we've enjoyed meeting every single nurse and helping them and guiding them through the journey into digitising their assessments. The next slide, please. So WNCR directly impacts the number of patient records that we've now stored digitally. As you can see, over 16,000 assessments have been saved since up until the end of February, and they are now available to all clinical staff, including GPs around Wales. This means that if a Cardiff Vale patient is admitted to a patient while on holiday in Pembrokeshire, their GP in Cardiff can now view their nursing notes at a touch of a mouse once the patient returns home. So you can see straight away the amount and you know, how this is actually providing, you know, much more comprehensive information and data for all the patients in Wales. So the three of us in DHCW Business Change team for the project are so proud to be part of it. We've all felt real excitement that's been generated, which is really rare in the deployment of a new IT system. So we're looking forward to the next 12 months of making digital nursing a reality for the rest of Wales. So I'm currently in Glangwili. My colleagues Scott and Denise are in Mold and the Royal Glamorgan, and we haven't yet met any major objections to the system. Within the first week, everyone absolutely loves it. Next slide, please. So the other part of our role is creating e-learning, and we've created an e-learning suite of videos and slide packs, which we've maintained throughout, and adding frequently asked questions and making adaptations as required. And when we sort of what we learn on the wards, we'll actually we make the changes as required. This is available to all NHS staff on our on-demand training centre. So if you want to know more about the application or have a look through it, and your internal staff, put a note in the chat and we can send you the link. So when we're out on site, we're able to share our knowledge with the wards that come on board and give our reassurances of our experiences in areas. We don't have to tell fibs, we don't have to give false reassurances. We haven't yet met any nurse who is still nervous about using it within the first couple of weeks. By the end of that time, everyone loves it without exception. So the local project team in the health boards and DHCW's business change team present on the ward throughout those first weeks of implementation, and then our mop-up sessions in subsequent weeks give staff the confidence they need to embrace the new way of working. We've even had staff say that they're going to try to do their Tesco shop online because using the devices has changed the way of thinking about technology. So if we are able to change just a couple of nurses' lives for the better, then even better. So that's me, that's my part of the implementation, and I'll pass you over to Leslie.
Hiya everyone, and this is really moving on from what Kerry-Ann has said. I think we can't emphasise enough how much of a culture change this has actually been out there clinically, to see nurses embracing it in this way. And this slide depicts some of those testimonials to go along with the experience that we've had. I think it would be fair to say from the beginning we were all a little bit nervous to see how our nursing staff would pick this up, but they've picked it up and run with it, and so a lot of our fears were unfounded. So you can see from the top there that it's been absolutely amazing, and that realization that it's like the system has always been there. It just fits right into practice is a strange phenomenon that we're finding, and people actually saying you can take other stuff away from us, take all the paper you want away from us, but don't take WNCR away. And I think that's an important testimonial as well that comes through from the staff. And people have embraced it because obviously we have agency staff and students who come through our service as well, and we are looking at different ways of managing that. So it's nice to see information boards go out there. So we've used a blended approach, not all digital. There has been some people who've put screenshots on information boards for staff who work by night and in preparation for the system come in, because we're rolling out to quite huge university health boards. So people are generally hearing about it before it hits their environment. So some people might want to visit where that is. I think it's important to pull out from this one that people have been scared out there. One of the last testimonials on this slide is, I didn't sleep much the night before, but there was nothing to worry about, it's been fine, has been the general testimonial for everybody, I think. So there's nothing about the system that has raised concern, and I think its simplicity and its cleanness has meant that actually using it has been a joy for most people, and they will extol the praises of it. So if I can have the next slide. I know Fran talked about the standardisation of and the evidence base around the risk assessment, but that has been a huge piece of work, and actually getting everybody in Wales to use the same forms and to agree how they were going to risk assess certain things has been a huge advantage with this programme, because then across Wales we can actually measure and gain some genuine population information that we haven't been able to get beforehand. It's definitely popular with our patients as well as with our nurses, many of them noting that they that there's no duplication, or all of that has been reduced. We learnt an awful lot from running the pilots prior to the go lives, and I think there were some amendments made with those. And that was as much for us to learn along the journey as well as the impact on the patients too. So it increases compliance and timeliness, and certainly what we're finding is the more people are using it. I work in Hywel Dda, and we were one of the first to go live way back in April of last year. The speed at which people have picked it up and are using it now means that we have released time for nurses to actually do more nursing care, as opposed to the 70 odd pages that Fran talked about earlier. So it's definitely got increased patient safety, and it is a system that we do access for investigations and even looking back over care as well, and it can be accessed after people have been discharged, which is a positive, and as both speakers have said, for transferability of patients into different care settings. It's been amazing. And that last bullet point there is around the healthcare and monitoring standards. So we are using it in some of the early adopter sites as part of our audit tool as well. And I think you'll agree that anything that can reduce the burden of audit is definitely worth pursuing, and that's been very helpful with WNCR. So some of the other outcomes are the increased evidence we've been able to already produce. Most areas that have rolled this out are producing quality reports back to their board. Nursing are definitely owning, and what we're getting is a lot of people saying how proud they are and how professional they seem to think that it conveys. It conveys a very different nurse, and it also leaves us quite open to accepting of other digital systems that will now be coming our way in the next few years. The access for temporary staff has been a big learning, and one of the considerations with that is now we're looking at providing access for nursing students throughout Wales that isn't temporary. And that's quite a huge undertaking, as we obviously work with multiple universities, but sorting that out would be a huge step in the right direction. But the temporary access has been something that we've learned along the way how to manage. It is documentation from admission through to discharge, so it is the whole way, not just the assessments that were shown on the slide earlier. It definitely improves communication, and the wider multidisciplinary team have been interested in this from the outset and use it quite frequently, and those would be our social workers, our GPs, and also our physios and OTs as well. I mentioned the reduction in duplication, less repetitive questioning you'd hope to see, and staff felt that the new documentation did improve the assessments of the patient's need to inform the care they ultimately got. And it was getting everybody involved, from our healthcare support workers to inputting into the record. So if we move to the next slide. What we'd like to show you now, I think, is as DHCW produce a newsletter, and there's a newsletter coming out, and it'll have some frequently asked questions that have come from these engagement events within it. But I think it might be nice to show you a video which conveys the nurses in their environment and how they've felt about it. I'll hand over to that.
Hi, my name is Christine Evans. I'm the ward manager on the Neuro Rehabilitation Unit in East Portobello Hospital. It's become such a fantastic way forward for nursing, in that it's clear, concise documentation. There's no room for error. It highlights all the risk assessments that we need. It's easily accessible for everybody, all the MDT, physios, occupational therapists, speech and language. Anybody can access the WNCR at any time, and it's become a real valuable piece of equipment for the nursing staff.
It's changed how I work because everything is in one place. You never lose a bit of paper, and you don't have to run around the ward looking for something.
I think it's better to capture all the information with the patients as well, so you can go through everything in one go. So it definitely saves time, and I think it's better for patient care because it means we can spend more time with them than completing paperwork.
It's a lot easier. All the information's at the touch of a button, all the risk assessments are there, and we can read everybody's writing.
The system's been quite easy to use. We were given a lot of support and reassurance from the IT department when we first got up and running, and the access to it is quite easy to navigate once you get used to it.
Using the computer to input patient notes has been very beneficial. On a personal level, I'm dyslexic and I find it very difficult with my spelling, so it takes me a lot longer to write my notes. But using the computer format has eliminated that problem, so it's levelling out the playing field a bit, really, and actually enabling me to speed up my notes because I'm not having to Google how to spell everything. So it's much easier, and it also makes it easier to understand other people's notes because everyone's got different ways with their handwriting, so it just makes everything clearer.
Hi, I'm Trudy Young. I'm the tissue viability nurse here at Velindre. For me, the important thing is about the pressure ulcer risk assessment we use at Velindre, which is a Purpose T tool. The Purpose T tool is part of the risk assessment suite on the WNCR, and what I like about it is that staff, when they're completing it, cannot submit it unless it's completed in full. So where in the past, when we used the paper versions, we had errors and omissions, this doesn't happen with the Purpose T, and that's absolutely superb. Also for me, for audit purposes, I can look back at the scores, look at the equipment being used, and it helps me to give a picture of what's happening to the patients on the ward in relation to their pressure ulcer risk assessments. It's a great benefit to me.
Hi, my name is Jane Brady and I'm the Senior Lead Nursing Informatics Specialist for Betsy Cadwallader University Health Board. For me, we're at a very exciting time in BCU currently because we are planning to go live hopefully the first week of March with the Welsh Nursing Care Record, and that will be in one of our community hospitals. We've started that engagement and had conversations and trying to get plans in place, and the feedback that we're getting currently is that everybody's really excited about it and feel that it's been such a long time coming that they can't wait to get going.